Dr. Blair was talking about was the teeth whitening. You know, it's about what patients want. And what I do a lot is scripting, getting patients to schedule, say yes to treatment. Last year, I did a little survey of just my Greenville and surrounding area practices. And in the last 2 years, even in a terrible economy, which I think a lot of you would say, and this area had pretty high unemployment, my average office around here went up over $170,000 in production and collection. Not working any harder, but introducing these systems. And one of the things that we do is we talk about dialogue and improving case acceptance. And along that line that Dr. Blair was talking about in kind of using the hygiene and being more productive is in the area of whitening, for example. So any hygienists in the room? Hope a few, okay? How often do you initiate the conversation about whitening? You initiate it, not where someone like checked, yeah, I'm interested. That's easy. That's that's the weenie way. You know, that's easy. But how do you bring up whitening and not offending the patient? Anybody? How do you do it? Thank you.
You're welcome.
Okay.
Now that I got them all nice and clean, I don't know if they were my teeth, they like really, really easy. So if it's something you ever want to talk about, it's always available.
Well, I thought you said they were already pretty.
They are pretty, but if it's something that you'd like to improve on, it's really easy.
Nah, I'm not interested, thanks.
Okay.
Kind of tough, right? Yeah, you want to take a shot. You're brave. Usually when I get on somebody, they don't take it. But let's go. Come on.
I mean, normally would have like a picture up and say, is there anything that you would like to change about your smile?
Why? What's wrong with it?
Well, nothing.
Then why are you talking about it?
Is there anything you would like to change?
No.
Okay. Well,
Yellow's my natural color. So you kind of set yourself up to fail in some of that, although the patients would never do that with you. But I want you to understand what's kind of going through their head. They think a little different than we do, right? Now, let me try to stump you, if you will. Your name? Nikki? Okay. Since it's only fair that I give you a chance to try and mess me up. Are you ready? Because you're brave.
Right.
Okay. So, Nikki, we've taken and we've done all this. So, Nikki, do you mind if I ask a couple questions?
No.
Have we ever taken a shade on you before? Okay, a lot of patients are asking us how they get whiter teeth, and they see all these commercials on TV, and so they're very interested. So if it's okay with you, I'm going to take a shade on your teeth today, show you where you are, and I'm sorry? You don't want to? Okay, well, here's where I'm at, and here's where I was before, and if that ever interests you, let me know.
Okay.
So now I've given them a visual comparison. Now usually, and she's really trying hard to get me, and that's okay. But she didn't. Right? Because most patients, what are they going to say when you say, can I take a shade? That's not offensive, right? Here's where you are. Here's a couple shades whiter. Does that interest you? If it's yes, here's what we can do. Now, I also have this little fun thing on my iPad here. So what I'll do is I'll just go to like bleaching, and let's say, do you have Zoom or do you have in-office? What do you have? You in-office trays? Okay. So I'll just pop up in-office trays. And here's a couple things we can do in our office. And I just hit play, it kind of goes over everything we have, or I can hit automatic, and it rolls through. And here's some before and afters of some of the things we've done. And we can actually just show that to them. If we even have our own photos, we can just import that in. If I want to, I can even grab this little yellow marker and say, this is, sorry, it doesn't work on the photo part, but if I backed up here, I can make little notes there or whatever I want to do. And, it's $800. So I've got that right at my fingertips for whatever I want to do. So visuals are always real powerful.